I promised earlier, and I'm coming back to it, that there are several areas of health coaching that are out there, and the number of focuses is probably changing every day, but here's sort of a big bucket list. There's a lot of attention on stress management, and both in the corporate setting, and I would say also just in clinics as people are looking at clinical conditions that are often driven by stress. It's also life transitions, everything from divorces and changes in relationship to job changes to dealing with the clinical conditions and how that changes people's lives, and a lot of caregiver work around maybe you are a young parent who is also caring for your aging parents, and how do you navigate that and keep your full-time job, etc. We have some end of life coaching that goes on, young adults. We have young adults who are trying to navigate the world that is more challenging than ever. And there's a lot of depression and anxiety and other needs that are specific to those people in the world. And we have more and more coaches going into that field. Chronic disease has been our bread and butter for a long time, but that's a growing need to help really motivate people to make good lifestyle changes to help manage their chronic clinical conditions. Physicians and physician burnout, and I would add to that healthcare burnout. I think we're going to see an expansion into other healthcare providers, including nursing in the near future. General health and wellness, most everyone needs to make some preventative and health and wellness goals and needs support in the doing so. New moms is also a growing area of focus. There's a lot of work about that transition for having a new child, and maybe it's not the first one, but how to navigate it all, how to take good care of yourself while you're caring for others. Cancer is an ever-growing need, and I can think of a client I had a couple of years ago who, after her acute treatment was over, was just really shocked by how much of a gap she felt, because she had such an intense treatment phase, and then all of her support kind of went away except for her 6-month checkups, and she felt really lost about what's my new normal and what's my life all about and how do I start again after such a devastating diagnosis. And so that's a really area where coaching can be really powerful. And if you look around, there are tons of assisted livings and other kind of senior living environments cropping up, and there's a lot of need for supportive seniors. And finally, executives who are needing to manage their well-being with their very highly demanding careers.